Good morning, Mr. Lee. Thank you for coming in today.
Of course, of course. You know my son, Ben?
I do. Good to see you again, Ben.
You too.
Thank you. Mr. Lee, would you like Ben to join us, or do you want him to wait in the waiting room?
I'd like him to stay.
Okay. Let's see. Well, we haven't seen you for a little while now. About 6 months ago, it looks like.
That sounds right.
Okay. And, it seems you've done very well with your hip replacement.
I'm walking around the neighborhood again. I miss doing that.
Oh, I'll bet. Yeah, getting out and walking in the fresh air is great. So we do have some things to go over today, but before we begin, do you have any concerns that you'd like to discuss?
No, I feel like I'm doing pretty well.
Well, great. Then let's use this opportunity then to focus on brain health. How does that sound?
What do you mean by brain health? Are you checking to see if my brain is healthy?
Well, yes. This is similar to how we check your heart health by taking your blood pressure. The brain ages like the rest of us, and it's important to periodically check for any change because your brain health affects your overall health, among other things. And this way we can identify and address any problems as they come up.
That makes sense.
Okay. Well then, first things first. Do you or does somebody in your life think that you have trouble remembering things?
Well, if you ask Ben, he'll say yes. But I think as we age, we get a little more forgetful, don't we?
I agree. He's more forgetful.
Okay. Well, since Ben is also noticing some memory issues, then I'd like to ask you both a set of questions. And Ben, before we begin, can you fill out this questionnaire for me, please?
Certainly.
Okay, great. Thank you. To start with, Mr. Lee, I'm going to give you a name and an address, and I want you to repeat it back to me. And I want you to remember the name and address because I'm going to ask you to tell it to me again in a few minutes. Okay? All right, are you ready?
Yes.
Okay. John Brown, 42 West Street, Kensington.
John Brown, 42, Kensington.
Do you remember the name of the street?
Brown. No, he's Brown. West Street.
Okay, and what's the date today?
February 11,
All right, and what year is it?
2023.
Okay, very good. Now, here is a piece of paper for you and a pen, and I want you to draw a circle. And then in the circle, I want you to write all of the numbers to indicate the hours of a clock. Okay, now would you add the hands to show that it's 10 minutes past 11 o'clock? Okay, great. Now, can you tell me something that's happened in the news recently?
They had a big snowstorm up in Lake Tahoe over the weekend.
Okay, now what was that name and address that I asked you to remember?
John Brown, West Kensington.
Okay. I'm going to shift gears a little bit now and ask you some questions about your daily activities. Sound good?
Of course.
All right. For each of these things that I'm going to mention, I want you to let me know if you have any difficulty in performing them, okay?
All right.
Okay? All right. Do you need supervision, direction, or assistance with bathing?
I do everything in the bathroom just fine by myself.
Okay. And how do you get dressed?
I can dress myself.
Okay.
Well, sometimes I get buttons in the wrong holes or my socks don't match. Ben does help me with that.
Okay, understood. Are you able to get in and out of bed or a chair without assistance?
Yes.
Okay. And how about eating?
Still managing to do that fine on my own.
Okay, just a few more of these and we'll be done. Are you able to use the telephone?
Ben got me one of those mobile phones.
Okay, and do you have any trouble using it?
He programmed the numbers in, so it's easy enough.
Okay, great. And how about shopping? Do you do your own shopping?
Ben does the big shopping for me on the weekends. I still go to the farmer's market every Tuesday.
Okay, I know you live in the city and you don't have a car. How do you get around?
I stopped taking the bus when my hip was bad. Steps were too much. Since then, I just stick to my block, and then Ben drives me anywhere else I need to go.
Okay. Do you prepare your own meals?
Breakfast and lunch. Ben comes over for dinner most nights. He's very good in the kitchen.
Okay. Does he also help you with your housekeeping?
I try to keep up, but he's always cleaning something on Saturdays when he comes over to help me with my meds.
Oh, that was actually my next question. How does Ben help you with your meds?
He fills up my pillbox for me. It's a lot to keep track of.
Yeah, I understand. Does he also help you with your finances?
I balance my checkbook and I pay all my bills on time. Sometimes he asks to check it, and it's always to the penny.
I ought to get you to help me balance mine.
I'll have to charge you a fee for that.
All right. All right. Well, thanks so much for going through these questions with me. Perfect. Thanks, Ben. Why don't you give me a minute just to go over these responses here? Okay, so in the beginning of our visit, you both reported Mr. Lee's memory problems, and some of the responses here today also suggest that there are some memory issues. Would you agree?
Yes.
Okay.
I agree.
Yeah. All right, then. What I'd like to do then is set up some more tests, and we'll include some blood work, and then we'll set up another appointment after that so that we can go over the results. Okay? Do you have any questions for me right now?
I can't think of anything right now.
Okay. Mr. Lee, you've made it very clear that your son plays an important role in supporting you. But does Ben also have a legal authority to make health-related decisions on your behalf?
I make my own health decisions.
Well, of course, but in the event that you were unable to, have you legally designated somebody to make healthcare decisions on your behalf?
Oh yes. Ben is my healthcare agent.
Okay, good. In that case, then before the two of you leave, let's make sure that we have all of Ben's contact information.
Yes. Okay.
Okay, great. After this visit, if you have any concerns or any other questions, don't hesitate to call, okay?
Thank you, Dr. Wagner.
Okay, it's my pleasure. Now, let's move on and talk about some of the other things that are on our list, okay?